Welcome to This Explainer. You know, if you've ever watched your kids struggle to catch their breath, you know it is literally terrifying. But we're going to turn that fear into power today. We're taking some pretty complex clinical information and translating it straight into actionable, empowering steps to help you manage your child's asthma at home.
So, here's our agenda. We're covering the reality of childhood asthma, those tricky triggers and airway mechanics, how to spot the warning signs, medical and nursing management, and finally, those all-important key takeaways for your family.
All right, let's jump right into Section 1, the reality of childhood asthma, a global challenge.
Let's just pause and look at this massive number. 262 million. That is how many people globally were affected by asthma in 2019 alone. I mean, it's the most common chronic disease out there, touching families across literally every demographic. But the good news here? Because it's so incredibly common, the medical community has a very deep, well-researched playbook for exactly how to handle it.
Now, for parents, the onset is usually the absolute scariest part, right? Things like low birth weight, prematurity, or even early exposure to tobacco smoke or air pollution can bump up the risk. But get this, asthma most frequently rears its head between the ages of 3 and 5. It's a super critical window. Some kids, they'll actually grow right out of it. For others, well, it's the start of a journey to find that perfect combo of daily preventer and reliever meds so they can basically live symptom-free.
Moving on to Section 2. Triggers and airway mechanics, understanding the causes.
You can kind of think of these triggers as sparks. And the really frustrating part, they are totally different for every single child. For one kid, the spark might just be a standard cold. For another, it's environmental stuff, dust mites, molds, pollen, or maybe even strong soaps and perfumes. Oh, and the data shows that children who are overweight or obese actually face a greater risk here. So your very first job as a caregiver, put on your detective hat. You need to figure out exactly which sparks are igniting your child's symptoms.
So what happens when that trigger actually gets into the lungs? Well, it can cause what doctors call a bronchospasm. Picture the tiny pipes of the airway just suddenly getting squeezed shut tight by the muscles around them. It's this immediate physical restriction. But, and this is key, it's not just a simple muscle cramp. There's this whole wild chemical chain reaction kicking off behind the scenes.
It's basically a domino effect. When they're exposed to an allergen, it stimulates these IgE antibodies, and that causes what we call mast cells to break down. When those cells degrade, boom, they release an absolute flood of chemicals. We're talking histamines, prostaglandins, leukotrienes, and this chemical flood directly causes the airways to become hyper-responsive. The end result is a triple threat. You get that bronchospasm we just talked about, severe inflammation, and thick, sticky mucus. That specific combination is exactly what causes the tight chest, the dry cough, and that terrifying struggle to breathe.
Okay, Section 3. Spotting the warning signs, recognizing symptoms.
So how does all that cellular chaos look on the outside? We really need to draw a hard line here between standard signs and severe, life-threatening ones. Standard signs? That's your classic wheezing, taking a really long time to exhale, and tachypnea, which is just a fancy word for rapid breathing. You might even see retractions, where the skin literally pulls in around their ribs. But listen, you have got to take immediate emergency action if you see the severe signs. I'm talking about nasal flaring, a kid who is just too exhausted to speak a full sentence or eat, or central cyanosis, that's a bluish tint to the skin, which means there's a really dangerous lack of oxygen.
This brings us to an absolutely crucial concept, the silent chest. Imagine your older child has been wheezing heavily, and then they suddenly go quiet. Naturally, your first instinct is probably relief, right? Like, phew, it's stopping. Do not be fooled by that. A sudden lack of wheezing during a severe attack usually doesn't mean they're getting better. Actually, it often means their airways are so dangerously tight and swollen that barely any air is moving through at all. A silent chest is a massive, massive red flag.
All right, let's look at Section 4, medical and nursing management, treating asthma attacks.
When you're in the hospital, the medical team moves fast. The frontline rescue medication is usually salbutamol. It's a beta agonist, and it works super quickly to just relax those squeezed airway muscles we were talking about earlier. If it's a severe case, they might throw in something like ipratropium, you might know it as Atrovent. Then, to fight the actual core inflammation, they bring in steroids. And here's something you might not realize. Breathing that fast dehydrates a kid really quickly, so they'll use aggressive hydration and mucolytics to thin out all that sticky mucus clogging things up.
But it's not just about the meds. The nursing care here is incredibly hands-on.
Nurses do a lot of physical interventions to help clear out those airways. We're talking administering expectorants, doing postural drainage, and literally percussing or gently tapping the chest to knock that trapped mucus loose. They also make sure your child is changing positions frequently and meticulously replacing those vital fluids lost from all that heavy, labored breathing. The ultimate goal? Bringing down that respiratory rate, getting oxygen saturation safely above 95%, and finally putting a stop to that dry, hacking cough.
But, as the source material points out, asthma is rarely just treated in a hospital bed. The real front line? That's your living room. A child's asthma affects the whole house, siblings, parents, everyone. The anxiety, the sleepless nights, it definitely takes a toll. Which brings up a pretty vital question. How do you, as a family, cope and actually take back control?
Which leads us right into Section 5, Key Takeaways for Families, Action Plan for Families.
Okay, these key takeaways are all about being proactive. Number 1, you've got to actively identify and dodge those specific environmental triggers we talked about. Number 2, absolutely master that inhaler technique. Seriously, just like a nurse would, watch your child use their inhaler to make sure the medicine is actually getting down into their lungs, not just hitting the back of their throat. Number 3, stick like glue to a daily self-management plan for those preventer meds. And lastly, have a crystal clear emergency action plan. If things go south, you should never ever have to guess what to do, you just follow your plan.
I want to wrap up with this really empowering thought straight from the clinical sources. Yes, childhood asthma is incredibly daunting, but with the right education, careful observation, and a rock-solid family plan, your child isn't just going to survive asthma. They're going to learn to manage it themselves. So, I'll leave you with this. Are you ready to stop letting asthma dictate your family's life and start giving your child the tools to take control of their own breath? Thanks so much for joining me on this explainer, and I'll catch you next time.